Good afternoon, William Rosewood. My name is Mihiraa. Let's start the warm-up session. Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, I will develop a nursing care plan and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There's also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your roleplay.
Good morning, Mihiraa. I'm William, one of the nurses looking after you today. I just wanted to check in on you after your surgery. How are you feeling right now?
A bit nervous, to be honest. The thought of moving around makes me worried I might hurt something or pull my stitches. It's quite sore when I try to shift position.
It's completely understandable to feel that way after an operation. It's a very common concern. Thank you for being so honest with me. The reason for my visit is to do my regular clinical observations and, most importantly, to help you start moving about safely. To begin, could you tell me a little about what you've managed to do so far? For instance, have you been practicing any of the breathing exercises or trying to move around in bed?
I've been doing the breathing exercises with the spirometer like the physio showed me, but I've been too scared to try and get out of bed on my own. I moved my legs a little while lying down, but that's it.
That's an excellent start, Mihiraa. Now, I want you to know that what you're feeling is completely normal, and it's very wise to be cautious after surgery. The fact that you're already doing the breathing exercises and moving your legs in bed is fantastic. That's a huge and very important first step. I really understand why you'd be nervous about getting out of bed on your own, and that's exactly why I'm here to help you do it safely. The reason we encourage moving a little bit so soon is that it's one of the most powerful tools we have to prevent complications. Keeping your body moving, even just a little, dramatically reduces the risk of developing blood clots in your legs or pneumonia in your lungs. It helps your circulation, keeps your lungs clear, and it's the fastest way to regain your strength and independence, which ultimately means you can get home to your own bed sooner. The key is doing it the right way to protect your surgery site. I'm going to be right here with you to guide you through it. The safest way is to first roll onto your side, then gently push yourself up with your arms while you slowly swing your legs over the side of the bed. You'll then sit on the edge for a moment to make sure you don't feel dizzy before you even think about standing. We'll take it one small step at a time, and I won't let you do anything you're not ready for.
That sounds less scary if you're here to help. But what if I feel dizzy or I can't hold my weight?
I'm so glad that sounds a bit better, and your question about dizziness is an excellent one. It's one of the most common worries patients have, and it's very important we address it. That feeling is exactly why we never want you to try this alone the first few times. Mihiraa, I will be right beside you every single step of the way. Taking even a very short walk is incredibly beneficial for your recovery. It helps prevent your muscles from getting stiff, gets your blood flowing to help you heal, and can really improve your overall sense of well-being after being in bed. To make sure you feel completely secure and to prevent that feeling of not being able to hold your weight, I have a walking frame right here for you to use. This isn't a sign of weakness. It's a smart tool that gives you tremendous support. It will provide you with excellent balance and allow you to distribute your weight through your arms, taking the pressure off your abdomen. Most importantly, it gives you the confidence to move knowing you have a steady support system right in your hands. I will help you get positioned with it, and we'll be right next to you to steady you if you feel even the slightest bit unsteady.
Okay, I think I could try with the frame. How often should I be trying to do this?
That's a great question, and I'm so pleased you're feeling ready to try. The best approach isn't about long, exhausting walks. It's about listening to your body and starting gently. Mihiraa, we recommend aiming for short, frequent walks that you feel you can tolerate, perhaps starting with just a few minutes at a time, every couple of hours during the day. This consistent, gentle movement is far more beneficial for your recovery than overdoing it all at once. The most important thing is to know the signs that mean you should stop and rest immediately. This includes if you feel a sharp, sudden pain at your surgical site, not just the general ache we expect. You should also stop if you feel excessively fatigued, dizzy, lightheaded, or short of breath. This is your body's way of telling you it's had enough for now, and we always listen to that. Rest is just as important as the activity itself for healing. Now that we've talked about how often to walk and when to stop, what other concerns or questions might you have? I want to make sure you feel completely prepared and confident.
I suppose I'm just worried about the pain getting worse and whether everything is okay inside.
Mihiraa, thank you for sharing that with me. That is an absolutely valid and very common worry. It's completely natural to be concerned about what's happening inside and if moving will cause more pain or harm. I want to reassure you that a key part of my job during this process is to be your extra set of eyes and ears, constantly monitoring for any sign that something isn't right. This is why, before we even stand up, and then throughout our short walk, I will be performing clinical observations to ensure everything is okay. This means I will be checking your vital signs, like your heart rate and blood pressure, to make sure they are stable. I will be monitoring you closely for any signs of dizziness or discomfort. Most importantly, I will be frequently asking you about the pain at your surgical site and may gently check the area myself to ensure there is no increased swelling, redness, or signs of strain. My entire goal is to make sure you are safe and that your pain is managed. With that in mind, would it be all right with you if I perform these observations now so we can proceed with your first walk confidently, knowing that we are doing so safely?
Yes, that would be all right. It does make me feel better to know you'll be checking all of those things so carefully. I think knowing you're watching for any problems will help me relax a little bit. Okay, I'm ready when you are.
Wonderful, Mihiraa. That's exactly the right attitude. I'm going to start the clinical observations,